Hello, medical assistants, and welcome to Module 9. This week, we are talking about a topic that we've actually talked about before. We are discussing the topic of medical emergencies and sort of how we prepare for those. So let's talk about what are your learning objectives for this week. So, by the end of this week, here is what you should be able to know and to do and have a better understanding of. So the first thing that we have is explain the role of a medical assistant during emergency situations, whether that be the need to do CPR, first aid, or how we really, handle emergency situations, whether it's in the office or outside of the office. You should be able to demonstrate the proper first aid, bandaging, and emergency response. So this week we're going to review some of the things that we talked about in your first quarter when you learned first aid and CPR. We're going to learn how to do some different bandaging techniques, things like a figure 8 and a triangle. We'll learn how to apply splints. And then what do we do in emergency situations, like if a patient were to faint during a procedure or to faint during an exam. We're going to develop an emergency response plan that would be utilized in the clinical setting. So knowing what to do if, we do have a patient who goes unresponsive. When you're in a clinical setting, you become a team, and each team member has a role. One of them will call for emergency services, the other will start CPR, the other will grab the first aid kit, one will grab the emergency medicine box, kind of understanding what that response team is really doing and what your role would be in that response team. Properly utilize a PDR or physician's desk reference, drug handbook, and other references to identify drug classifications, usual dosing, unusual side effects, and contraindications. This is something we've been working all along with from week 2 to week 8. We don't have a course project this week, but we'll talk about some of the emergency medicines that are on hand in a crash cart for the simple fact of what they do and actually how they are used in emergency situations. You're going to develop those traits for a professional medical assistant, so really knowing what do I need to do in any sort of situation, how do I communicate with patients, with family, with others in my area, so other maybe coworkers, maybe other staffing, and really knowing how to handle yourself in any sort of realm with a patient. And lastly, preparing for that CMA exam. So I will probably give you guys another test this week. I think that you guys are doing fantastic. The grades are much higher than what I would expect to see at this point. So you guys are doing so great. I just want to keep that momentum going as we head towards the end of the quarter. I will also pass out the final exam study guide. Even though we still have 2 weeks before that, I want to make sure that you guys have plenty of time to really study and feel prepared for that exam, both the online lecture exam and the in-class practical exam. So that's what you should know by the end of this week. I hope that you all have a wonderful week, and I will see you on Wednesday. Bye, everybody.